In this video, we are going to see some criterias when we are writing a OET letter. So, based on that criteria only, we will be getting that marks for our OET letter. So, basically, on OET letter, we have some preparatory. There are two phases. So preparatory phase and then a writing phase. So in OET writing, so we have two phases. First one is preparatory phase. So that examiner will be giving oratory phase. So that is for 5 minutes. So examiner will be giving that task letter. So we have to prepare for 5 minutes. So what are all the things we have to write, like that one structure we have to create within that 5 minutes. Okay. So this OET writing will be followed by first listening, then reading, then writing, then speaking. This is the order of our test. Okay, so first one is preparatory phase. So second one is writing phase. So in this letter we will be start writing. So totally we will be having 40 minutes for OET writing. So 5 minutes is for preparation, then 40 minutes for writing. So when we are practicing, we have to finish within 30 minutes so that it will be easy for you to write in that exam. So first of all, after getting that the OET task letter, first 6 questions we have to find answer for. Immediately we have to find answer for 6 questions, so that the structure of our idea of our OET letter will be become easy. That's what I'm coming to say. So first one is reader's name. First one, we have to identify the reader name. Second one, who is the reader to whom we are writing the letter. So first one is reader name. If the name is given, yes, so lastly we have to write sincerely. If not given, simply they have written as charge nurse or something like that, so we have to write faithfully. So every letter we will be writing your sincerely, your name. In that place we have to write, if the reader's name had been given, it is sincerely. If it is not given, they have started as a charge nurse or a registered nurse, you can start it as faithful. Okay, so who is the leader? What is the post of the leader? What they are doing, whether it is a psychologist or a sociologist or a clinical nurse, community nurse, anything, we have to know that one. So third one is who am I? Who am I? That is writer. What is the role of our writer? What is we? What is am? That is who am I? Whether we are a midwife or charge nurse or registered nurse or a community nurse. So this is third thing. This is an important thing. So what was the purpose of the letter? Purpose of the letter, we have to identify this one. Okay, fifth one, whether we are referring the patient or we are updating the information to same hospital, or we are in behalf of, whether we are writing in the behalf. That is the purpose why we are writing, whether we are referring, whether we are transferring or whether we are discharging, like that we have to write. So that is the purpose, main point for what, that is the purpose. So next one is why the patient was, why, diagnosis of the patient, that is important. So if they are admitting for, if we are writing a letter to the patient will have some problem, so that problem we have to identify, whether he is recovering or recovering from or recuperating after. Okay, so if it is a surgery, we can write as recuperating after. There's two words. Recuperating means after, recovering means some fever or mumps, like that, medical terminology, some mental illness, something. Recovering from. So if we are using recovering, we have to use from. If we are using recuperating, we have to use after. So this is the main thing. Sixth one. Second thing, whether it is a known case or unknown case for the reader. So that the person who are reading the letters, whether he know the patient or not know the patient, that part we have to be very clear. That is the main important questions we have to identify from the letter. So I will just take a letter and then I will give you some ideas how to identify these things for the patient. Okay, yeah. So I just want to take one letter. So that is yes. So which letter we can identify? This is a basic letter. So I will teach you one basic letter for you. Okay, I will write this Jimmy Davis letter, so it will be identified. So first one, reader's name, whether they have given reader's name. Whenever we are getting a letter, so like this we will be getting the letter. First one is like case note. So patient details, they will be written. So whenever we are getting a letter, the last part we will be having a writing task. First we have to read this writing task. What they have written: write a letter to manager, Sam Aged Care Nursing Home. So manager of Sam Aged Care Nursing Home, informing him or her about the patient's discharge, informing him or her of treatment provided, care given, patient's condition and discharge plan. So these are all the things we have to identify. Okay. First one is reader's name. From where we can identify? So here only they have given manager. Then where he is a manager of Sam Aged Care Nursing Home. They have written simply like this. So we haven't got the name of the manager, so they haven't given. So no. So we have to write yours faithfully at the end of the letter. I have uploaded this Jimmy Davis letter. Okay, I will upload the sample paper of this Jimmy Davis letter in my YouTube channel. So just I will give a clear picture of this. So we will be choosing yours faithfully. So who is the reader? Yeah. So reader is the manager. Aged is same. Aged Sam aged care nursing home. That is the reader. So who am I? Third thing. So third thing we have to come to the letter. So in this they have given read the case note and complete the writing task below. You are working as a staff nurse at Apollo Hospital, Brisbane, where Mr. Jimmy Davis is admitted. So I am a staff nurse, Apollo Hospital, Brisbane. This is the place I am working. This is I am staff nurse. So if we are a staff nurse, what designation we will be having? Yes, registered nurse we will be having. So we are a registered nurse. What is the purpose of the letter? So if we want the purpose, we will be so here we will be a discharge plan. So in this letter they haven't clearly mentioned. So discharge plan. So what is that? So what is the purpose of the letter? We are, and also main thing. So we are recommending them to take care of the patient. So we are in this case we are updating the information. So before that I would like to tell you before the purpose of the letter. First one is whether it is a known case or unknown case for the reader. So reader is a manager of Sam Aged Care Nursing Home. So you just see the patient address. So that is also Sam Aged Care Nursing Home. So the patient is already a known case to this nursing home. So in this case we are not referring, we are just updating their progress. Okay, so this is a known case. Like this we have to, if the right reader's address and the patient address was the same, or the reader's address or the reader's address or that staff nurse address, that the letter who are writing is the same, so it is a known case. Okay, so diagnosis of the patient. What is the diagnosis? Yeah, so this is medical history, complaints of, so admitted time, diagnosis made as a stroke. So this is the diagnosis for the patient. That is an important question. So he is recuperating after. If you are writing recuperating, it should be after. If you are writing recovering, it is from. So purpose of the letter. So what is the purpose? We are updating the information to the nursing home which the patient had already with the client. Okay, so this is the way we will be interpreting. Following this I will give you some idea. Okay, so next one is, this is from writing task we can identify all these things. So next then, so in this within 5 minutes we will be identify all these phase. Okay, this is preparatory phase. Preparatory phase, 6 questions. So second thing is we will be implement our ideas. So this is writing phase. So what is the framing of the letter? So first one, framing a letter, how it will be. So we will be how to frame a letter. So this one, so how to frame a letter means, so I will tell you how to frame the letter. Okay, so first thing is we will be writing date. So I will be continuing this page. We will be taking a, so here we will be writing a date. Okay, date we will be writing. So we will be leaving one line. Okay, then we will be writing reader's name. If they are given reader's name, reader's designation, followed by address. Nothing, this punctuation should be completely avoided. This is a format of a type of letter. So if you are following from the starting, so we will be following at the end too. Okay, date, reader's name, reader designation, address we will be writing. So next one is we will be leaving one line. So next one is salutation. Next one is salutation. So dear Miss Adams or dear charge nurse, like that we will be writing. So just I will give the framework. So just I will the framework. Okay. So this is salutation. So we will have to leave one line. Then regarding. So regarding to whom? Regarding to this symbol we have to write to. So name of the patient. So Mr. Name of the patient, Mr. or Mrs. X. This is name of the patient. Comma. Aged. If they have given age, so you have to write a comma, aged. So X. Sometimes they will be giving a instead of age, they will be giving a date of birth. So that how we have to write date of birth. This is a one method. So regarding, okay, regarding Mr. X. So if they are giving date of birth, so same next line, date of birth. So always it should be left side, date of birth. So how we have to write? To July 2018, like this we have to write. Okay, if they are giving both age and both date of birth, you have to mainly prefer the date of birth because that is the accurate thing. So this is one example. Okay, so next one, so I will give a sample letter of this. So, okay, so next one is the body of the letter. The body of the letter should be contain 200 words. So first paragraph is purpose paragraph. Okay, first paragraph should be purpose color. Always we have to start from right side, right corner. Okay, first paragraph we will be briefly writing the purpose paragraph. So second paragraph will be expanding the purpose paragraph. So we will be elaborating their medical history. So third paragraph will be, third paragraph will be previous medical history. Previous medical history. Previous. So after that, fourth, if the patient is having previous medical history, you have to write in this order. So fourth one is social history. Whether he is an alcoholic, where he is living, like that we have to write. Okay, this paragraph format is for a medical profession. So we are a registered nurse. We are referring the patient to community health nurse. So in this time, what is the purpose of this letter? Shortly we will be writing in this first paragraph. So we will be expanding the purpose paragraph elaborately what we have done during their hospitalization. Suppose if they have been undergone a surgery like appendicitis, what they have been done, how we have managed her sugar level, how we have given a surgery site care, all these things we have to write in this expansion of the purpose paragraph. Okay, so if you are writing a letter to a community health nurse, it is very important to write his previous history if he is having the previous history. So last one is social history, where for a community health nurse it is very important the social history, where he is living, with whom he is living, how many children he have, whether he is an alcoholic or not, and what all the things he have interested. That is a final one is recommendation paragraph or plan paragraph, planning or readers paragraph, whatever we can, whatever the criteria have, we have to. So all the recommendation, what are all things readers have to do, all these things we will be writing. So finally one sentence, common sentence. If you have any queries, please do not hesitate to contact me. It is a final letter, it is a final line of a letter. Every time we will use to write. Okay, so after that all from this purpose to this letter only it should be 200 words. So after that you will be writing yours, Y capital, yours sincerely. If the name had been given, you have to write sincerely. If name is not given, you have to write faithfully. Okay, so you leave one line. So in this case we are registered nurse. Okay, so full stop, nothing you have to write. This is one simple framework of the letter. Okay. And also yes, what are the criteria for, so what are the criteria they will be assessing in the letter? That is an important thing you have to. Criteria assessing for the letter. This is a, on this basis they will be putting their mark. So I have given a framework of the letter. So if you are writing this letter to a social worker, this order of this will be changed. If you are writing a letter to a doctor, it will be different. If you are writing a letter to a director, completely, director means director of any center, director of any authority, different from a medical field means completely it will be different. So in that case he is a non-medical profession, we have to avoid all those things. So what are the criteria I will be explaining in this form. So criteria, so in the criteria, what are the criteria they will be assessing in this letter? Okay, criteria, first one is in that purpose paragraph. So I have told you one purpose paragraph in middle. So they will be assessing the purpose paragraph first. For this, what are the things they will be assessing? What to do, why to do. These two things they will be assessing for the patient. So this is what to do and why to do. What is what to do? What they want to do for the patient, whether it is a community care or whether it is an assistant. If example, if we are writing a letter to if you are writing a letter to a community health care nurse after a knee amputation surgery, so what he will be needed in that community, what to do, what she will be doing in that community setup for that patient. She will be monitoring continuing support for her ambulation. So for his medication compliance, she will be taking care of. So continuing care, supportive care, assistance, like that we can use. So what to do? Continuing care, support, medication history, like that we have to write. So why to do? Based on the diagnosis. For example, I am writing this letter to refer so and so who requires ongoing community care and support at your facilities or on your facilities or from your facilities. So that is what to do. Why to do? Mr. He is diagnosed with, because he is recuperating after a knee injury or knee surgery. Okay, along with this, his discharge or transfer plan. Discharge plan we have to write. So first of all, they will be assessing this 3 things in that purpose. So if you are correct, you can get a score in that mark. Okay, for the purpose they will be giving 0 to 3 marks. Minimum mark is 0, maximum mark is 3. Okay. So second one, what they will be assessing, content. That is the exact elaboration of the developmental paragraph. So we will be telling as developmental paragraph. So these are all the developmental paragraphs. So we are starting from present medical history and we are ending with a recommendation paragraph. So this is from admission to discharge we are telling to the patient. So that is one of the things. So in developmental paragraph, so content is very important. Okay, content is very important. So what we have to do here, we have to first, as soon as we have get that letter, we have to avoid irrelevant data. Okay, so then what we have to do, we have to find the relevant data. Okay, so main thing we have to understand the, so letter will be like hint, so dash like that, hint it will be. So we have to identify the main thing, then we have to identify, mainly we should not change the meaning. So that is the main thing. Okay, we should not change the meaning. So that is all about content. So main thing, we have to avoid the relevant data, we have to find the relevant data, and we should not avoid changing the meaning. Okay, so these are all the things very important. So third thing is, they will be seeing for conciseness and clarity in this letter. You will be, so how neatly you are proceeding the letter, it should be around correct. You have to summarize the topic neatly. Okay, neatly. So it should be around 180 to 200 words. The body of the letter should be 180 to 200 words. And also we have to use the connectors for linking the 2 or more sentences. if you are using connectors means it will be very easy for reader to, that evaluator to, yes, connector for linking two or more sentences. That is, however, even though, therefore, in spite of, like this connectors we have to use. Okay, so that is very important. Whether I have missed anything, let me check. So this is my writing practice book. That's what, for all those stuff, so I will be writing in this book only. That's what I'm saying. Yes, that is the thing. Fourth one is Gondrian style. Gondrian style. So what is mean by Gondrian style? It is a format to write a letter. So it should be formal. Letter should be formal. It should never be informal letter. So letter should be formal. So what is the thing? No short forms. Please avoid short forms in you. So nowadays we are started to text in short form. So same things we will be writing in this letter. So to avoid all these things. So key information should be highlighted. So key information should be highlighted. How we will be highlighting the key information? How, example, so for a diabetic patient, their blood sugar monitoring and their diabetic medication compliance is very important. So we have to tell this reader to explain the reader why it is important. So how we will be highlighting, like, it is important to monitor his blood sugar level along with his medication compliance, like that. It is some extra sentence we have to add. It is, so that is the purpose. It is important to, imperative or importance, like this we have to highlight. It is important. It would be appreciated. It is important. Yeah. It would be appreciable. Like that we have to highlight the key information. Okay. So it should be non-judgmental. What is non-judgmental? Always we have to write the patient habit in non-judgment form. How patient is a smoker. In that letter, OET letter case note, they will be writing it as he is a smoker for 3 days. 3 years, past 3 years. Same things we should not be write in this case letter. So how we will be writing? We have to modify the words, like he is having the habit of smoking. So like that we have to modify. So he is obese, like that. In the task letter they will be writing as obese. So how we have to write that? Simply, if we are saying it, a patient is obese, means that is non-judgmental. How we can write that? Her BMI is above the recommended level. So like that, politely we have to write it. So this is non-judgment. If it is he is a social drinker, means how he is having the habit of drinking socially, like that we have, that is a note. That is very, very important. Gondrian style is very, very important in this OET letter. So letter should be formal. Shortcuts mean short, no short forms we have to write. So we will be writing in short forms. Yeah, you can write MRI as short form, X-rays, USG you can write in short form. But sometimes we will be, MI, what is that MI? Myocardial infarction, MI. So we should be write that MI as myocardial infarction. all sorts of things we have to avoid. USU you can write, USU you can write. So I will, while teaching the letter, you will be identifying. So it should be non-judgmental. So final thing what they have, yeah, no medical jargons, no medical what is jargons. So no medical jargons, like medical words we have to complete, whether it is a no, whether it is a medical profession or whether it is a non-medical professions, we have to write the letter in a sentence. So medical jargons we have to write, we will be writing hypertension. So how we have to write? Increased blood pressure we have to write, not hypertension. Patient is having diabetes mellitus, we should not write diabetes mellitus, we have to write patient is having high blood sugar, diabetes, like that we have to write. Yeah. So fifth one is organization of the content. As I have organization of content, as I have mentioned before, first one is purpose, second one is explanation of the purpose, third one is what is that, reader, what is it? According to reader means it, what is the community health nurse, medical history, previous medical history, social, like that. According to the leaders we will be changing. So last one is recommendation paragraph. So recommendation paragraph, okay, this is according to that. Okay, so in this way you will be fetch marks. So you have to separate the content from the task letter. You have to separate it. So which one way we have to add? So sixth one is language, final one is language. So in language, what are the things we will be assessing? First one, tense, whether we are using a proper tense, we have to use the tense correctly. Second one is subject verb agreement. So if you are starting with a subject, verb should be there, that subject verb agreement should be there. So I will teach you when I am writing the letter, that time only you will came to know. So gender interchangeability you have to avoid. So that is a quite common mistake in OET letter. So we can't able to identify whether he is a female or male. We have to clearly identify. So in gentle, that should be avoided. So fourth one is punctuations, quotations, all those things you have to be very careful. It is very careful. Punctuations, it should be very careful. So we have to avoid spelling mistakes, main thing. Okay, so sixth one is yes, last one is proofreading after writing. So we will be allotting a 40 minutes for the letter. We will be getting a 40 minutes for the letter. So within 30 minutes we have to write a letter. So next 35 in that 30 minutes we have to write 31st to 35 in that 5 minutes, 30 minutes to 35 minutes we have to read the letter completely. Then in that 35 to 40 minutes, if you have any modification, you have to correct that. So this is about simple. This is a simple thing. If you're writing a letter, it will be used to it. Yes. So this is the frame. So this is the framework of the letter. I will show you. So you just take a screenshot of them. Yeah, this is the framework of the letter. This is the criteria where they will be using this marks. So one. Yeah, this is the criteria of the letter. So in that purpose paragraph, you will be getting a 3 marks. So remaining 7 marks. For purpose paragraph is alone 3 marks, maximum of 3 marks, minimum of 0 mark. So this paragraph you will be getting a minimum of 0, maximum of 7 marks. Okay. So purpose paragraph alone you will be getting 3 marks. This is 7 marks. Okay. So content, how you are developed a content. So how you have developed. So for that you will be get some marks. So conciseness and clarity, whether it is a 120, some linking words, however, even though if you are using all those things, you can fetch marks a lot. So they will be finally saying the Guardian style, whether you have used all these things. So organization of the content, if it is very neat and clear, so you will be getting all these things. So 6 one is language, 10 spelling. So language is basic for an English test. So they will be seeing this criteria. Okay. Yeah, this is the 6 main questions. Maybe after getting a letter, OET task letter, you have to read all these 6 letters within 5 minutes. You have to first identify this, then you have to read. Okay. So this is the main thing of an OET letter. Yeah. Thank you.